Good morning slash afternoon, everybody. I know others are going to be joining, but I know we've got lots to go through today, and we'll be having a conversation actually at the end. And it's so lovely to see Gord and Mario because we might bring you consciously into the conversation. This is only going to be in part a presentation and in large part a conversation, and with Helen, Vince, and I, but our community partners as well. So I will get us started here. So I just want to say welcome everyone to the March Research Rounds. For those of you who don't know me, I'm Catherine Donnelly. I'm the director of the Health Services and Policy Research Institute. And I know a number of you, or a few of you, are coming from outside of this area, but I want to recognize that those of us presenting, Helen, Vince, and I, are coming from the traditional territories of the Anishinaabe and Haudenosaunee. And I want to recognize it's the first rounds of our springtime. And I looked out the window today in high hopes that it was going to be warm, but it turns out it's -18 with the wind chill. But I feel grateful for these spring days and what's to come ahead of us. And I just want to say thank you to each of you for spending an hour with us over your lunch break as we consider how our research at HSPRI can help support principles of equity, diversity, and inclusion. And today, specifically, as we think about these principles and how they can be applied to understanding the powerful role of communities and partnerships, and thinking about how we can support aging in place, specifically from a lens of an equity lens to support those communities who may not be as advantaged as others. So as I alluded to, we'll be doing a bit of a formal presentation traditionally, but we're going to kind of go a little bit differently here just because this research is a little different. So it's going to be Vince and I doing a bit of a formal slideshow presentation, and I'll introduce Helen, who will be our guest in terms of our conversation. So happy to introduce Helen Cooper. For those of you who don't know her, she has been the I guess CEO, the president of the Oasis board here in Kingston, and she brings a long, rich history. From 88 to 93, she was the mayor of Kingston, and I want to make note that she was the first female mayor at a time when women weren't in politics. And, even just listening to her lens, her experiences over those years, it's been remarkable learning for both Vince and I. She came with that from a wealth of experience thinking about global health and education. She spent time in Africa teaching. She did her master's at the School of Economics in London. So again, brings a breadth of experience to our partnership. I introduced myself already, but I'll also introduce Vince DePaul. He's a physiotherapist by training, and he's currently the chair of the physical therapy program. And he and I have been the co-directors of what we call the Oasis Evaluation Project. So with that, I will stop and I will jump in. And I just want to also formally acknowledge that Dr. Jordan Miller is up for the next set of rounds at HSPRI. So he's on the call. He'll be looking and presenting some compelling research where he looked at an RCT looking at physical therapy interventions in primary care. So it's like hot off the press research. So Jordan's up for two, the rounds as well as the methods. Okay, so I am going to share my screen. Hope I can do that. Okay, so this is a little bit of a different, and I'm going to try to zip through the formal part because I feel like this is just setting the stage for the real juicy part, which is thinking about the power of health services program evaluation and thinking about university community partnerships. So if you go to the Queen's website, the first thing that you see when you click on is solving the world's greatest problems as situating our work at the university. And I wanted to situate this work as our greatest problem that we're here collectively, that we've been working together for almost 9 years on, is focusing on an epidemic of loneliness and isolation. And I want to say that in conjunction with thinking about how we can support older people to age in their community in places that they want to, with the supports that are around them. So that has been our collective efforts. And I say collective because it's truly been the work of multiple people. And I just want to reiterate that from the very beginning. And this presentation is really going to talk about the arc of a community university partnership that's been grounded in collaborative research. And will be a reflections on an 8-year relationship. So also, just wanting to acknowledge our role in this, that this story comes before Vince and I. And this is really a story that starts in the community, and it starts with a real life problem and a solution created by older adults themselves. And so I won't go into all the details, but just acknowledge that Vince and I were very grateful to be able to come and work with the Oasis program over these years. And this is the place that it all started. And so when we think about university community partnerships, I've got a few references down below. There's been lots written about frameworks and how to do community partnerships. What's the benefits? What's the challenges? What's the pitfalls? What are the negative sides that for both parties that might come about? But what we want to talk about today is how complex they are, how interconnected, once you are doing this well and for a long time, your relationships are, and you become interdependent on each other in terms of learning and growing together. And it's really what we see this for, if you're doing it well, that you're working together for social change and social impact. And you really are hoping that those align in terms of your final goals. And I was laughing at myself, and Vince and I were chatting, and there's a machine here, and it makes it seem like it's highly mechanistic. In some ways, I like this because all the parts are critical. There's not one part that's more important than the other, and they all need to work together and be greased at all times to keep them going. But it's really much more of an ecosystem, I'm going to say. A complex ecosystem that's really we see from the ground up, and a live system, again, that needs to be nurtured in all different ways. So if we go back to this mechanism, these are all the pieces that keep us going. So we've got the research team, we've got our research collaborators across the country. We have our funders, and different funders we connect with in different ways. Some we just send end reports. Some we work with extraordinarily closely, and they're actually close partners. We have trainees of all sorts, from undergraduate students to graduate students, OT, PT students doing their placements with us, a rich network of community partners that are too many to name, and I'll show a photo in a second. All of the members, the volunteers in the community, some of the members are volunteers, and then the program implementation team, so all of the coordinators who are actually running the program. So I won't go into all the gory details here, but this is a snapshot of all the people that we've been working with. This is kind of the outcome. We've put in a large shirt partnership, and this is all the people that we've been naming on that partnership, and there's more. And just want to recognize that it's taken trust and time to get to this point. So again, for the research perspective in the room, we've come at this rigorously as well, founded in collaborative inquiry and integrated knowledge mobilization. So this idea that we're collectively working together to figure out like what are the problems that we're working on, and how do we work together to share the information? And we'll show you some examples of how that's been done. We've used multiple methods. So we have both an evaluation and a research arm. The evaluation arm is really making sure that what we're doing is value and worth, and iterating the program as we go. That's been largely from a design perspective, looking at before and after type. We do a set of questionnaires, and we do a set of questionnaires on a yearly basis. And then we have our research arm, where we're asking more theoretical, research-driven questions. So the evaluation is really about, does the program work or not specifically? And the research is more theoretical, I would say, but also from an implementation and realist perspective. So what works and how? We've done, and we're just finishing a quasi-experimental design that's taken 5 years. We have 6 intervention sites and 6 control sites that we've been doing evaluation every year for 5 years. We're just in the midst of looking at the data. We've done specific qualitative studies, observational studies, cross-sectional using large administrative data. So it's been a complex from a research perspective as well. But we're not here to talk about that. We're here to talk about the partnership and what we've learned and what we might share with others in that way. So we started I shouldn't say we, Oasis started in 2009, the original site. And so it became incorporated in 2011 and has always maintained base funding from the local health integration network, now Ontario Health East. We consciously have pictures from the original site and original members with permission from them. And this started in one site here in Kingston. And again, it was grassroots idea, member-driven model. This idea that it was a partnership with members, the landlord, and the Kingston Council on Aging. And again, they came together and envisioned this lovely and incredible program. I'm going to say, and this is where we see the university community partnership as so crucial. Coming both of us from health sciences, we took for granted how much data is available in the health system world. But what's really challenging for our community partners in the community social support sector, which I have come to recognize the completely undervalued element of our system and how much work is done and how little support they have to do some of the rigorous evaluation of their impressive work. And so this very first evaluation of OASIS was done with the Queen's Center for Studies in Primary Care. They did a survey of people in the OASIS building and a non-OASIS building. They looked at loneliness and they used the RI home care data to estimate who might have gone to long-term care and who didn't, and did kind of a bit of a napkin math to say how much money could be saved. I just want a shout out to Jyoti Kochika, who was the evaluation lead at the time. And it was with that data that we were able to apply for our original funding back in 2017. And so these funding requirements, it was the Ministry of Long-Term Health, Long-Term Care, Ministry of Health and Long-Term Care at the time, Ministry of Seniors, and Baycrest. They were three grants that we applied to. And as everyone knows, you apply to lots of grants and mostly don't get them, but we got all three. And that was based on the data that we had initially. And so without that partnership, we never could have been able to be successful. That again was a bit of the ball that got rolling for all the others. So that very first grant, it allowed us to work with the OASIS site to see if this was a one-off or could we actually see this happen. And Helen might remember all these. I was like going back to the treasure troves. We actually had all the members draw a logo. And so it was on literally a napkin. This little logo was drawn, and then we went to tender to get the first example of the visual. And you could see the members themselves were iterating. So widen the circle. Do we want the plant? Do we like the roots? And then we asked them to describe like what were the elements of the program. So this idea of pillars was there but not there. And you can see how people were saying, no, it's socialization, not activity. So again, we used all of their descriptors and words to start to think about what this program looked like. And then from there, we expanded to 6 sites because we got more money than we had thought we were going to. And that's when we brought in our partners, McMaster and West and London. And so you can see the OASIS information site, January 9th. So this was at one of the new sites that we were trying to figure out, would they want to be a site with us? And we literally drove around and would try to see like who might want to join this burgeoning group that we were having. So the outputs, and this, if it was a logic model, as Vince nicely reminded me, it would be opposite. The outputs were a logo, a charter. So we actually had the values and principles that the members themselves wrote that have been at the forefront since that time. We did a evaluation, a pre-post evaluation, and it was our first foray into community development. But really the impact, and this has been the grounding part of going forth, has been the start of a trusting relationship over 8 years, a commitment to each other, the learning, both understanding other than pure research, like how do you do work that's funded by ministries? What does that look like managing budgets? How do what you say you're going to do, you have to do that explicitly. New ways of working with all the different types of partners. And we had to learn what it's like to do sustained program delivery. And we decided at that point in time, Vince and I together said, we are committed to this and we won't, any community we start, we'll not leave. And that we will only expand if we have money to keep the original sites and as we grow going. So I won't spend much time on here, but this is the OASIS pillars that came about and some of the original qualitative components. And I'm going to hand it over to you, Vince.
Sorry, thanks, Catherine. Um, so picking up on that early those early funding successes and all the work that went into that, we had developed this small network of partners that we this is this first sort of example of us trying to pull people together in terms of this broad partnership of researchers who are ourselves, our colleagues from McMaster, colleagues from Western and London, um, but then also importantly landlords, property owners, representatives come together, and of course older adults who are in the residences that were had Oasis sites in them. So we came together in Toronto. We still uh, we've actually moved on to bring people to Kingston. We'll talk about that, but we acknowledge the benefits of meeting in Toronto, and we came together and had this development and open discussion. And this happened just before the shutdown, actually. So that January 2020. So it was excellent. Lots of learning for us how to have these conversations, how to engage people, how to consider how do we get people. So we brought people from Kingston, members to Toronto, but it was so uh, essential in that building of the trust and those relationships. So it was a learning experience certainly for myself and I think for Catherine in this. We won't spend a lot of time on this because we have done this before, but the from that initial work, and this was based on those conversations at that gathering, but before and after we were doing this research evaluation with the original site, but looking at the new 6 new expansion sites at baseline. So we had collected data regarding social well-being, but also nutrition and physical activity. And we're demonstrating through that early research the benefits from the experience of having an Oasis program within the original site compared to these new sites that didn't have that program. But the importance of this, it's not the numbers, but we did these demonstrated benefits. We were able to embed within our future grants, and that really created a foundation for being able to solidify our understanding of where we needed to go, but also support create a story and necessary data to actually seek more funding. So the other part of this story was then we took that initial work with the original site. We created a process and um, uh, method for expansion and evaluation that we described and published. Prior to that, Simone Parniak led for our group a scoping review of all the work that was happening in NORC. NORCs in north anywhere in the world, but really highlighting the lack of this work in Canada and identified the gaps in the literature, which drove us again, identifying where we needed to go in terms of our follow-up research. So this is where all of that foundational work allowed us to apply and successfully get funding from a couple of sources to do different types of work. So the first one was the 2021, we were successful in a CRHR grant, and I believe that took a couple of tries at that grant, so which isn't unusual, but that we were able to get a grant to look at, do a rigorous evaluation of the 6 expansion sites and comparing them to match sites going forward, and that we're just wrapping that work up. So as we created through that work trainee opportunities. We embedded with that was the community development and activities. But it really was a research focused grant rather than an implementation. in 2021, we had also applied to, well, this actually was an opportunity that came to us, and then, but it was a long sort of relationship building with a funder, so Walton's Trust, who were interested in the work that had been happening from the original site, but also the work that we've been able to do to actually look at the spread and implementation. So, and not as much interested in the actual research, but certainly the evaluation. And so this funding that came in 2021, 2023 from Walton's Trust was allowed us to spread, to look at processes for implementation. It also, and I think this was, again, it was more than just a funder. It was I feel we've been mentored by this funder to think and organize ourselves around planning and governance, and really put an emphasis on that, thinking about the future and sustainability. And this allowed us to broaden our network in terms of the development beyond just Oasis, but think about where Oasis sits within the broader ecosystem in terms of aging in place. And there are partners, our community partners that we partner with directly, but there's other partners who are working in this space to come up with solutions to aging well in place, including the NORC Innovation Center in Toronto, some colleagues out of Women's College and Mount Sinai who are doing work related to NORCs, as well as the National Institute on Aging that is more of a policy and knowledge translation shop that does lots of work in aging more generally, but has done work in this area. So that combining these two arms of this is where we really started to separate it out. So looking at research and implementation, and these funds helped us to do that.
I just have to
last
interrupt
thing,
you
yeah, you
because
do that.
I just want to show the
Yes,
logo piece.
yes, you go ahead.
I was just going to say, we spent a lot of time on these colors. And so that was sort of been a fun piece about the branding too. I sorry, Vince, I just had to
No,
point
no,
that.
you're right. And as I was about to say, go ahead, I was missing that. So this branding, so that was a nice, and again, much of this again came out of the original logo and just thinking about the branding and partnering with a partner of one of our partners, actually, one of our community partners in Thunder Bay. They connected us with a branding and graphic design, and is just, again, not anything I had ever been involved in. So it's before this, and it was just yeah, fun. And I'm colorblind, I must say, so I had less to do with the
That's
color
why I thought I'd
choices.
jump
But
in.
okay, yeah. All right. So then we had again this broader look at NORCs in more general. So we pulled together a symposium trying to engage not only our Oasis direct partners, but reaching out to people broadly across the country to come together to discuss and set a research and policy agenda related to NORCs. So this was something we did in Kingston, and we've actually continued to lean on some of those priorities that we as a group identified to extend our work, but also the work that we do with some of these broader partners. So in addition to that, we've continued to have annual Oasis gatherings, so where our Oasis partners from across the country come together in Kingston once a year. This is, and maybe you can speak to these as well, Catherine, but this is just another, this building sustainability has been core to that ethical expansion concept that we are not only evaluating, but we're trying to establish funding long term. So this is developing case for investment documents, developing materials through, there's a group called Healthcare Excellence Canada who has been a nice partner to help us describe this, the Oasis, as a promising practice and a solution so that other people can use this, and so that is available externally. We've done mapping for NORCs across the country. This is work that we have led, but there's been other work that our partners, including older adults and members in Oasis, have led related to increasing attention to this model and the need for this model. So these are just two examples of where they've reached out to media and had great uptake in terms of the getting describing what's happening and some of the, again, not that we've done, but things that have come out of the Oasis sites across the country. So why don't you pick up from here?
Sure. Yeah, yeah. We'll just go quickly. I'm just realizing that
Yeah,
we've
yeah,
got so much great conversations, and I'd love to hear from Mario and um, Helen and everyone else here. So just other to say is that each bit of funding has given the whole group a little bit different expertise and skills. So we received some additional funds that has allowed us to develop an annual evaluation. And now we have a minimal data site that we have been deploying on a yearly basis now. So not just thinking about those 6 sites, but how do we maintain and evaluate and support evaluation for a growing entity that's now 23. This says 20, but it's actually more about 24, 25 and growing. And so I'm just going to end here by saying that we have now Walton's Trust has trusted us to continue on, and we have 5 years worth of funding now to focus on how to develop a not-for-profit. And so Oasis National is what we're focusing on, is how do we essentially take what we started as a research project that was a collaborative university community partnership with Oasis in one site. And then we were starting to then do research, starting to evaluation, starting to expand, and we were collectively working in our small team here doing all of that. And now we're going to be looking at how do we separate that out. So the research that we're doing here at Queen's will be a very synergistic support for what will now separate and be a national not-for-profit that will be supporting all the units and have its own staff and be focused on sustainability that way. So I think we'll end there because that's just a few of our partners. Just wanted to say thank you to everybody. And I'm going to stop sharing because I think the real part of this presentation is going to be in the next half hour as we speak to Gord and Mario, who didn't know they were going to be spoken to right now, and Helen as well. So Helen, I'm going to kick off the next part of the presentation by asking you some questions.
Okay.
No pressure. She
I
did
am
know.
unmuted.
You knew about this, so.
Yeah.
Just thinking back now that we've been doing this for almost 8 years now, it's amazing. Just wanted to start by asking you, like from your perspectives from the very beginning, what do you see as the benefit for the Oasis Queen's partnership over the last sort of 8 years? And the second piece, how do you see this has evolved over time?
Yeah. I've been engaged in volunteer work in Kingston over many years. This has been quite an interesting, unique experience for me. I'm I those of us who volunteer in the not-for-profit sector think we're doing good. We wouldn't be doing it, but we have no idea whether we really are or not. And so the combining with experts who are able to develop a data set and interpret it and explain it is a huge boost when it turns out that it confirms what one thinks is what is really occurring. And what Catherine and Vince have been able to show is that the work of Oasis produces excellent results for a variety of people. The interesting thing, of course, as we know, is that more women have been participants in Oasis programs than men. But I won't go into that. There are other offerings for men as well. So I think that's it gives volunteers a huge boost, a shot in the arm to say what you're doing is really, really important work. there are all sorts of developments in medical science or whatever that may introduce longevity into the population. But what you're doing is equally as important and as effective. So I think that's a really important component of this. Uh, I would go on to say again, my experience of living most of my life in Kingston. I remember an editorial in the Whig Standard years ago when the Whig was a real newspaper, and so the editor remarked that Kingston was an archipelago of a group of distinct islands. There was the university community, there was the military community, there was the penitentiary system, there was the medical community, and they lived in their own little worlds. And after you've talked about these individual islands, there's a huge, vast population that lives around them that doesn't have any connection to any of them. And so it crossing these barriers is really important for this community. Certainly, it's been the members we involved with in the original Oasis. I'm trying to think there, but for the most part, I can't think that any had any connection to Queens.
Mm.
And and I think they were a little bit fearful. I don't know if that's quite the right word or not, about engaging with professionals with high academic qualifications. The wonderful thing that you did was bring in the students when you were putting the charter together. And that in itself was a huge boost to this population, which they thoroughly enjoyed. So I think breaking down these barriers between different societies within one so-called community has also been really important in all of us understanding each other better. I'll leave it at that for
I
now.
love that analogy. I hadn't heard you say that before, Helen. That's nice.
Yeah.
Yeah, it just makes me, yeah, just even to speak about that, the value of the breaking down the barriers, and I see from the university's perspective, it's of equal value, and I don't know that that's always been recognized. This connection, and from the value for students that as much as the members of Oasis have enjoyed interacting with students, what the students have been able to see and learn and bring back is we also are grateful for, but also see as it just couldn't be done in any other way that we on reflection.
I think too, the other is one could debate whether the original Oasis would be able to survive if it hadn't become part of a larger whole, because it's involving human beings. Circumstances forever changing, and it means people's needs over time change. And the huge benefit to the original Oasis to becoming part of a larger whole is learning from the other sites, sharing information, and getting support, because especially going through COVID, it was not a good time but it was we know what happened in long-term care in our communities. It's a very sad story in Canada. But we can say that there was nobody who was an Oasis member that suffered unduly from COVID.
I would say that was also in large part thank you to the community partners of Providence Care, Gord, and before him, Ben, and the infrastructures and supports, that interconnectedness, again, I'm going to say, of the ecosystem and how it operates.
Yeah, we just to build on that, Catherine, so this interconnectedness, so the original Oasis members certainly benefit from that, but we had opened 6 additional sites, and I know at the very least the 3 in Kingston and Belleville that were open and then had to COVID hit. We were learning from what was happening at Providence Care to get policies related to when we could be safe to open again, when how to interact safely, and all those pieces were so essential. So it's true just to think back about the benefit that we gained, although Providence Care was most directly is and continues to be most directly connected to the original Oasis. We have always benefited from that relationship. So
Vince, I was going to ask you a question. I know we had some
sure.
questions for each other, and then we can like open up, and
Mhm.
everyone else, please feel free.
Mhm.
I'm going to actually change. I'm going to not ask the first question I said, but I'm going to ask the second one because I'm really interested.
Because
A
you want
lot
me to
of,
see us stumble.
yeah, oh, just getting you. Some people would say this is not within the scope of researchers. That, although the university wants us to do like impactful community work, we have really expanded and been doing programming as well. And, what would you say, when, this is not for everyone to do this type of work and in this way, and just get your thoughts on that.
Mhm. Yeah, absolutely. So this is a conversation that we've had, and this is um, so just to acknowledge it's not um, for the faint of heart for some of these things in terms of because just understanding and um, part of the reason I do it and the reason I think that we do it is because of the clear impact that it has, and we it's been the easiest uh, project or idea, research idea to convey and to anybody. When you speak to anybody about this, if I have these conversations with family, with people in the community, it's understood immediately as to why this is why this may be beneficial, and as opposed to trying to explain some of the other work I do, which is very important work, but it's a bit of much more need for translation. So that's one thing, just the clear impact that you can see with this. That makes it all worthwhile, and that impact is you just need to go to a site on a day and see what's happening, as well as look at data that we have to represent that. But I think it's just that 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 is why this makes this all worthwhile. But it's not without challenges, and so it makes me think about and that's why when we think about is this really what my job is about? When we're ordering couches on for rooms and dollar store canvases for activities, and um, but it is because again, you this is part of the whole picture, and I think it's been just having to shift some of my early expectations about what research and what this is, and also not fall into daily we have as an academic we have outputs that are expected, or we either these internal pressures or real pressures, publications and sort of the more traditional metrics that that don't often actually encompass, or at least initially when I was entered the university, weren't encompassed. The community impact that comes with Oasis wasn't necessarily highlighted or prioritized. Increasingly, that's recognized, and that's what again, it's catching up, I think, with some of the work and the experience we have.
Yeah,
How would you
can I
interpret?
interject here?
Yeah.
Because um, this is really important research. I mean, we
Mhm.
can talk about uh, eh, medical research, which I don't in any way wish to discount, and in terms of encouraging longevity. But what we're also talking about here is encouraging a good life, and I uh, I keep going back to the Harvard
Mhm. Mhm.
longitudinal study, which I think everybody listening to this should look at. The Harvard study has gone on since the 1930s and has developed a mass of data pointing to the fact that, in general, people who develop good long-term relationships live longer, happier lives than people who don't. I also think back to my days years ago now involved in the early years study and how Dr. Fraser Mustard, former Dean of Medicine at Queen's, championed the cause of early years and published first in 1999 and was showing that community benefits for younger people, for infants and toddlers, uh, the the more they were a part of a community, a loving and caring community, the more likely they were to thrive as adults. And again, that's been well documented at this point. So I this is as important research for human benefit as anything else I can think of. So I'll just say that.
Thanks so much for that, Helen, and the affirmation. I thought what I'd do is, if you don't mind, Mario and Gord, I might put you on the spot here and ask you your thoughts just in terms of, and just a little brief introduction of your lens and your relationship with Oasis, and Gord, maybe Mario, you're off mute, and I'll ask you first. What's you're just new to, more like on the newer side of linking with Oasis, and what would you see the benefit of having the Queen's University partnership with Chats yourself?
Sure. Um, so I'm Mario Longo. I'm the VP of Quality and Strategic Initiatives at Chats. We are a community support service organization that services York Region and South Simcoe. It's a large geographic footprint. We met about a year ago, I think, and have been in contact and have been to the conference that you've scheduled last summer. I think for me, looking at my background, I kind of grew up in the communications, government relations role, and before getting to where I am today, but the value in the relationship, it's multifaceted. The first is that we have some members of our staff, Melina Day and Jesse Brown here today, and the value I see is one where they can connect with a community of practice and hear lessons learned, lean on each other for support, answer each other's questions. I have this problem, I haven't thought of that. All those kind of conversations. I think that's the one of the, I think, low-hanging fruits of having a community to reach out to. The second piece is a little bit more selfish in that we're looking at the research questions and the evaluation approach in an attempt to build a narrative that allows us to articulate the value of these initiatives. I think that's valuable to me because, like, you strategically chose that the only way you can expand is if you have the money to keep the original program. So that's what we need to think about, is how do we sustain the programs we have and continue to grow where the need is. And in order to do that, government is becoming more and more demanding to show me the evidence. And we always get compared to the hospital sector all the time. So it's like, well, you got to give us what the hospital sector gives us. So it's like, well, we're not the hospital sector. so the data sets are going to be different. And it always seems to be, at least some of the conversations I've had, and I know that they don't intend to, but it's like, how do we help the hospital sector in order to deal with their issues, like alternate level of care, ED admissions, readmissions. And I'm like, well, if that's all we're known for, I think we need to look at what the value it is that we bring to people's lives. And yes, I'm not saying that those things aren't important, because they are. Um, but it's not the only thing. We should not be measured by what we can provide to other people. We should be measured on what we bring to community. So the value in that regard is priceless, in my opinion, that we are able to showcase to funders and decision makers, and we'll have a larger group of organizations across the country that we can point to and say it's successful. You should mirror it. You should expand it. You should scale it. You know, government seems to have a problem with the word scaling, because generally scaling means more money, but it has an impact, and if we can illustrate that impact, and we are and we will, that's some real power right there.
Thanks for that, Mario. And it's making me realize too, as you're talking, it's really honed as a researcher, my skills in being able to clearly articulate what a problem is
Yeah,
and how we're going to respond to that. And then what's the methods we're going to do to collect the data we need. And I must say, I have learned so much and use that in other funding applications, that sort of that clarity of thought, because coming from a place where the problem was clearly identified, the need was developed, it makes me see that trajectory more clearly, and it makes me committed to do research that is useful now. Not that I didn't think my other research was useful, but this is really useful. And I try to think about, like, every time I do something now, this work will help inform this so that someone else can do Y. Gord, popping on you for your thoughts in terms of like thinking about, I mean, you're coming from a university, so it's, I mean, a hospital lens, and so you're used to data. Like, how do you see the university partnership from your lens?
Yeah, thank you, and great to be part of this conversation. Before I speak, Elliot, you had your hand up. Did you have something you wanted to add before I do, or are you okay after?
Oh, thanks, Gord. No, you go ahead. I can follow up on you. Thanks.
Okay. I'm going to just share a few remarks because I'm mindful of the time. I would say the relationship with Queens has been so beneficial with research, looking at sustainability, growing infrastructure, hope. I think if we look at the original site, it was a single, if we look at like the tree, it's now become a forest, and a single tree can be blown over or forgotten, but with all the nurturing of Queens. And I'd also like to say, Catherine and Vince, you've put in so much work, but there's others on the call like Shannon and
Yes.
Simone and so many others. Riley, who I've heard has switched positions. And so for everything that I think you're doing, there's actually 50 other actions that you've done. And there's a high level of humility and quiet kind of work, whether it's organizing something, running out to the dollar store, traveling across the country, whatever that might be. And so I think it's been highly valuable that now we have something that's sustainable. And I want to actually just share, so my role with Providence Care is with Bowling Green too, is to provide operational oversight. So I support our coordinator, who's Ashley Bates, and I'm also responsible for budget purposes. And then it's also working with Queens and so many other things. But I want to say normally with operations, there's a bit of a burden and there's risk and there's a bit of grind, but I've benefited so much personally and professionally by being a part of Oasis that it truly is life-changing. And I'm actually inviting my staff. I have some managers and VPs that I invite to events, and I have one that has FOMO, fear of missing out. She refers to Oasis as paradise. And so in other projects or other things in life, we try to include others, but I'm trying to include managers and leaders to come to this mature site because we benefit from it. So it's drastically changed. I have a VP that makes time and is developing friendships and just sits quietly with the group, and half to three quarters of the group doesn't realize like she's a VP, but she's just this person. And so not only, am I benefiting from Queens, but also from this site. And so my kids have been there. learning about it. They talk about Oasis, and so that's something that I'm benefiting. That's been truly amazing just to learn. And recently there was a member who turned 90, and she had 15 people from the group come in, but she's feeling young because she's now the youngest person in the 90s club because there's 7 others. And so there's so much kind of pride and support. And so, yeah, my hope is that we continue with Oasis National and building off a lot of strengths. But yeah, so that's what I wanted to share. A lot of gratitude towards Queens, the hard work, the determination. I think, Vince, you put it kind of mildly as far as some of the hard aspects of this, but we have so much to gain, and we need more sites, and we need to grow this so that it's a goal for me is that when you say Oasis, people know what it is. And we're there on this call, but not in other elements of my life. And so, yes, that's what I wanted to share. Thank you.
Thanks. And I swear this was not a plant. These are Mario and Gord. So nice to see you. And thanks for that. And it's not to say that everything is smooth all the time. I think that that's what we want to acknowledge, that, you know, anything that you do that's complex has struggles along the way. So not to paint just the only glossiness. And we could do another presentation on the other side. I call it a failure report, and, you know, learn lessons from our failures as much as our successes. I think just to let everyone know that, you know, this is not just always been the successes too. We've got about 8 minutes left, and I just wanted to make sure that we have a few more questions to each other, but open up the floor if others have some comments or questions.
Sure, Catherine. Maybe I'll just jump in after Gord here. I just wanted to follow up on your comments, Helen and Vince, just about whether, you know, you working in this space, and you guys have been working in this space for a long time. And I think a lot of other groups are now coming to this upstream space, looking that housing is super important for healthcare. And you're seeing other hospitals moving into this space, like South Lake. They have a program moving into the community. You see UHN moving into this space. You see other academic groups like the North Innovation Group also moving into this space. So that tells you a lot about how important and how impactful this space when you have people like UHN fully committing and moving into this space. The one thing so that's one of my comments, and one of my questions is, and I can see it coming through when Gord's talking, just how important the relationships are in creating these partnerships, and especially with respect to funding. And so I don't know if Catherine or Vince or even maybe you, Helen, want to talk about, and even the longitudinal aspect of that, when you have so much churn and change and staffing, how important that relationship is for funding pieces.
Yeah, because we have to be persuasive. I mean, I think particularly if we're looking at public sector funding, governments are very risk averse. They don't like bad headlines, right? And they would also be, those of us who've worked, I've worked with the provincial government and for the provincial government in terms of collecting information about, you know, it has to be numbers, how many people served, et cetera, et cetera. Getting to outputs is fairly easy to measure. Outcomes is very difficult. And so I think whatever we can, Elliot, it's hard work to persuade government that this is a risk worth taking. I think we're making progress. I think what we can do and that it happens increasingly, is looking at other examples literally around the world, where people are discovering more and more. I'm repeating myself. I'm going back to the Harvard study. It's extremely well grounded. It's academically well done, and it's the kind of information that we need to keep gathering. And of course, we're now the examples you cited in Toronto, UHN, are emergency room docs who said, we're just seeing the same people over and over again. They're frustrated. We're frustrated. there has to be a way out of this cycle. And so they're saying, yes, it's what's social determinants of health are critically important. And I was on the Premier's Council on Health Strategy with David Peterson in the late, it was the late the early 90s. Took over by Bob Ray in 1990. And I see Duncan Sinclair's on the call. Duncan was there as well. We lots of talk about the social determinants of health, but it's made very little progress because people just don't know how to cope with it. And because we're all living in our own little worlds, right? And what Catherine and Vince through this project have been able to do is overcome those barriers and show the powers that be that this does really work and that hospitals could actually divert resources accordingly and to good intent. Okay, I'm sorry I took up a lot of time
No,
there.
that was wonderful. I'm conscious of the time here, and I just want to. I know everyone's going to another meeting. I think we might have time for one other question if anyone has one. Otherwise, I think maybe what I'll just say to end this off as well is that I think the enormous mutual benefit is can't be articulated so much. Like I'm just thinking I've been transformed in terms of how I think generally as a researcher. I come at this as an occupational therapist, like coming from like what was the problem that I saw day to day, and thinking of everything. If I had known what I know now to start, I'm glad I did it, but it's been an unfolding sort of complexity as we've gone forward, and I've been so grateful for everything I've learned over time. And I guess I think for researchers, I guess I would say to everybody, if you can do community engaged research, yes, 100% do it. I would never say not to ever. My only thing I would say, if you do this, you have to be committed. And so my only worry nowadays is that we have this lip service to community connections, community partners, and that we have these partners for named only to submit the grant, and that we actually don't engage them in meaningful ways, or we use them for the application only, and then we never connect with them again. So what I would urge everyone to do is think of one or two projects and think of those deeply and what you want to commit to that's aligned with your values and those of the community you're working with, so that when you engage with them, it's actually the start of a relationship, not the start of a project. And so I think that's what I've learned from here, and that I was overseas in England. I'll just share this just to wrap up, looking at some pilot projects, as they called them, working with place-based neighborhoods. And they all didn't continue after the funding, or most of them didn't. But they all used the words pilot project, and the communities that they were engaged with, they all kept saying, trust was an issue. And so I guess I'm saying, if you go in from the perspective of the university person, that you're just there to test something out, you're not really showing your deep commitment, and why would anyone trust you? So, as the researcher, to Helen's point, people are suspicious of Queens for many good reasons. So it's upon you to be the person who is going to the dollar store and making those connections and commitment to the people that you're working with. So I feel very fortunate also to have worked with Vince on this. We've been aligned from the get-go, and Simone's been working with us, for 8 years now on this too. So it's a team that's fully committed. So I just want to say thank you to Helen, who's also been committed to us the entire time. And it's been the most incredible 8 years, and I know lots to come. And thanks to Gord and Mario and all the people on the call who've worked on this. So thank you, everybody.